Well, hey there, Tisha here, and welcome to the Hurdle2Hope Show live from Daisy Hill. And my gosh, how my life has changed. I am actually taking you up here because I told Andrew I would check out a rock that he has placed in front of one of my favourite trees. So I'm checking it out, and I thought I would do the intro from here. So I'm now sitting on the rock and look at that beautiful sunset behind me. I might be looking a bit tired. I had a big week. I went to Melbourne for a couple of days. For those who don't live locally in Australia, Melbourne is the capital city of the state I live in, about 2 hours or so from home. And it was a great week. Really enjoyed staying in a beautiful hotel. But also I ran a frontline worker wellbeing workshop. You get nervous before you meet a group of people. These were NDIS service providers, so those providing service to in the disability sector. And my 3 stages to thrive framework and the Hurdle2Hope roadmap, these are all concepts that I've created, and gosh, it feels so good when you're delivering those workshops and you really connect with people. So if you're listening to this podcast and I met you this last week, thank you so much. I had such an incredible time. It's really re-energising me in terms of knowing that what I'm sharing is connecting and it will help you as frontline workers, but also those who you are supporting. But I also think it's really important to remember that frontline staff are just like you and I in terms of dealing with their own interruptions in life, and lots of what I share on the Hurdle2Hope Show and through my business is all about helping all of us to move forward. So it's very timely that today's episode is all about nursing wellbeing. And I'll just move this around a little bit because, gosh, it's looking so beautiful. I'm a bit distracted, sorry. And I'm speaking to Mark Carter, the founder of MACH Health. Very excited. So towards the end, I'll share how Mark and I are doing something in partnership, which is very exciting. But Mark is a nurse himself. He's a wealth of information about burnout being experienced by nurses and what he's doing to address that. Whether you're a nurse, a frontline worker, or like me, someone who has spent a lot of time in hospitals, or you're, just part of the community and wanting to learn what others do, please listen to this episode. I think you'll get a lot out of it. Enjoy our chat, and I'll be back after the interview. Welcome to the Hurdle2Hope Show. I'm your host, Tisha Rose, and this podcast, it's about acknowledging that unexpected hurdles interrupt all of our lives, but it's how you respond that will define your experience. Each week, we'll be having real conversations with people whose lives have been interrupted and those who offer us support through our most challenging times. Each reminds us that even in the darkest moments, hope is always there. Thanks, Mark, for joining us here on the Hurdle2Hope Show. Welcome.
Thanks, Tisha. It's a pleasure. It's great. I've watched the episode so far, and I can't wait to have a great chat with you today.
Yeah, looking forward to it. And I do this with all guests, just so we've got audience members living overseas, out of Australia. So can you just share with us where I'm chatting to you from, and also give us a little bit of insider information about Mark? What type of things do you enjoy doing outside of work?
Sure. So I live in Ormeau in the state of Queensland. So Ormeau is a town between Brisbane and the Gold Coast, kind of out by the bay. It used to be like a little rural town. Now it's hard as hell to get into now, post-COVID with the population migration. But it's where we call home. We lived here before we moved overseas, and we were really happy to buy here when we came back. So we love it. Can't see us going anywhere for a while, and the kids love living across from the park. So you can't argue with that.
No.
Bit about myself, different stages of life, different things I love to do. So in my younger years, I loved to surf. I was an avid surfer. I'd 3, 4, 5 days a week down on the Goldie, between shifts, before uni, whatever I could. As life's changed and my interests sway, I'm an avid camper, cyclist and mountain biker now, so I try and get on the road and get a couple hundred Ks in a week if I can. But weather and magpies, it's now magpie season coming up. So, I don't want to be swarmed by the black and white army. But when I can, I like to get out and do things like that and sign up for crazy events like ultra long distance rides and things that push me, give me a goal and let me go as hard as I can for it. And I just think if you're going to set something, just complete it once. And then if you really can, go for it again. But I think just completing it's the key. So that's me. And I play guitar and a lot. Let's say fun with my wife and kids. That's the biggest joy, is spending time with them.
Yeah. Glad you put that in.
I can imagine my daughter saying, "Hey, why was I in there, Dad?" "Oh, I'm sorry, Charlotte. Sorry."
Yeah. No, that's great. And I've actually had a couple of guests now from Queensland. So I'm down the bottom of Australia, hence me wearing a jumper. And you in short sleeves.
Yeah.
Very different climates.
It is. It's nice warm, 25 or something today. So, and this is winter.
Oh,
So
great.
it's pretty nice.
Yeah, well, yeah, not like that here. But
No.
that's all right. That's all right. And why I'm really excited about this chat, and we actually met at a digital health festival. Sounds like
did.
it wasn't a musical festival. It was all things digital health, and we crossed paths. And I think we're both passionate about frontline workers and their well-being. And
Yep.
yeah, so we got chatting, and then hence inviting you on here, and we'll share with others what we're doing together as well. But let's take it back a step. And you were once a frontline worker working as a nurse. So can you, just share what drew you to that profession and, what that was like for you?
Yeah, sure. I don't know if I was drawn to nursing.
Yeah.
It's a real kind of weird way of explaining it, but I went out for my birthday one night with some friends, did something silly when I was half drunk, ended up in the hospital. That night, ended up in the hospital on my birthday, and 2 weeks later, enrolled for nursing. That was just it. Don't know how or why. I was at that time, I was studying a health science degree. I wanted to become a storm chaser, a meteorologist. That was my real key thing. And then it just flipped. Don't know why. And the rest of is history. Went through the degree, spent 15 years direct clinical care, from registered nurse, clinical nurse consultant, nurse manager, assistant director, through to a hospital administrator, overseeing the hospital after hours. I did everything in between. Taught at the university, marked exams, taught in the labs. It's an amazing profession. There's, I've seen multiple people in different jobs all around the world. And I will say this, frontline healthcare workers, policemen, ambulances, nurses, anyone in healthcare, we are a unique individual. We are, they would say, God's angels, if you want to put it like that. But I think we are the world's safety net. We tend to take a lot of the world's pain and fatigue and try and find good ways to send it back out into the world, whether we're caring for someone or we're thinking of caring for someone. And the experiences I had and the people I work with are still some of the most beautiful, smart, and just awe-inspiring people on the planet I've ever met. From my first boss, Michelle McLeod, I still revere her as a manager, and she's just an amazing people person, through to people I aspired to, Professor Jeb Williams in Melbourne, to people I met in Singapore. A nurse will always know a nurse if she's in the room, and they'll automatically get each other's humor. And there will always be a quirky story about, I saw a patient do this, I remember when this happened. And you can automatically build that trust in an instant, which I find doesn't happen anywhere else or any profession, because you have some kind of understanding of what they go through, what they may have experienced, the good, the bad, the indifferent, the sacrifices they make, the things they may have missed out on, like birthdays, families, weddings, all those things that are amazing parts of life that you tend to give up for weekends, for extra money to pay the mortgage. So having stepped away from it, went into business, I still practice clinically because I keep my registration, but I also still want to find out what's happening in the profession, from aged care through to acute care, through to clinical care, through to primary care, because we are at a tipping point as a profession. But wholeheartedly, I wouldn't change a thing. My wife's a nurse. She's an amazing nurse, has been, will be, and always will be. My mum was a nurse. She burned out. My wife burned out as a nurse. Most of my friends are nurses. I think my sister-in-law's just got into caring. So I think we're all just unique individuals, social workers. We're all the same. We're cut from the same cloth, just maybe with a different color.
Yes, yes. And I mean, I haven't done nursing, but I've worked as social worker in emergency housing. So, the stress in
Oh,
that field, and you're certainly not doing it for money.
no, no. I think most people take 99% of their job home with them. And that's where the damage starts. You think like,
Yeah.
oh, I can just leave it at the door. No, you can't, because you'll be getting in your car thinking, if something's gone bad, I wonder if I did everything. I wonder if they're okay. And it's the first thing you think about when you're waking up in the morning, coming back to work. How did they go? Are they okay? Did they survive? I hope they lived the night. I hope we did everything we possibly could. And it could be something small, but that never goes away. And where maybe in other professions, you turn off the computer, you go away, job's done, come back the next day. You finish your shift, you're done. And sometimes the scars can be really, really deep for people. The trauma some nurses and frontline workers go through is unrepairable at some points. And they back up the next day and do it again and again and again and again and again. And so I think it's a challenge for healthcare overall because it's now stretched to limits. People are stretched to limits. And my greatest fear out of all this is that one day when myself or my wife or God forbid my kids are ever in a hospital or my mum and dad, is that the healthcare workers, specifically nurses, because I am one, they can look at them and ask themselves in their mind, I'm pretty sure they're healthy, they've had a good night's sleep, they're eating healthy, they're getting good physical exercise, and they're mentally okay. Well, they're emotionally okay. Because if they're not, the chance of something going wrong goes through the roof.
Yeah.
And I see that as like a challenge and a mission to make sure that when that day comes, I know in my mind that person standing in front of the bed is looking up, or is being looked after, and we're helping them look after themselves, if that
Yeah.
makes sense.
Yeah, absolutely. And I think that's the thing as well. And the nurses and frontline staff, they're doing all they can to provide care. And how difficult that is for them if they're not being supported and they're making mistakes, and then that falls on them. And that's so not fair when the system's not
No,
supporting them.
no. And it does happen. Like everybody's
Yeah.
human. That's what I think most people forget. You're human. You're going to make a mistake. You do everything you possibly can not to. Like I will wholeheartedly say I've made mistakes in the past. Absolutely, everybody does.
Yeah.
But then you are probably at the limit of fatigue and you're tired and you're not willingly going out there to do that. It's
Yeah.
because a lot of things have lined up that have led to it, not you personally doing that. So I think, it's hard when people do make a mistake. They really take it hard
Yeah.
because they care so much. And it could be the smallest thing, like I forgot that blood pressure and they're at home stewing over it. Or that blood sugar was a bit high. I should have told the doctor. They're stewing on it. You think, oh, so it can be highly stressful for them, and with no positive ways or avenues for them to deal with it, or proactive, preventative ways to be in front of it so they can deal with it right there and then, it just compounds. COVID didn't help at all.
Yeah.
COVID probably brought the skeleton right out of the closet, and it's something that I think not just Australia but the rest of the world is starting to really struggle to grasp with the impact of what's going to happen.
Yeah. So give us some insight in terms of what's the actual, because I think sometimes we'll be in a hospital or we'll be getting a treatment and we just see the nurse on the shift, and think, oh, they're taking a while to get to me. I've been buzzing for a while. So what's the reality? Like, well, tell us if I know I saw something on LinkedIn. You recently did a full on week, was that? Just to
Yeah,
really report back on what the reality is of what nurses are facing. So can you give
yeah.
us just so people can really see the reality?
Yeah, sure. So I think depending where you're in the sector you're nursing you're doing depends on what you're going to be facing. So last week I did 60 hours in aged care. I did two doubles in that period. So a 14 and a 16-hour shift, just to experience, not that I wanted to by choice, but to actually go and go, okay, so what am I experiencing as an individual looking at a different lens? But for the average day for an acute care nurse in a general medical ward, you're rushing through handover as fast as you can, 5 to 10 minutes, because you may have 6 to 8 patients. You have to give all their medications out individually. They may have infusions, they may have dressings, they have to be washed. So you have to do all the personal cares for them. And by 8:30, 9 o'clock, the doctor's rounds are coming in.
Yeah.
That's if during that period, one of the patients hasn't deteriorated. They may have had a fall, they may have had a cardiac arrest, which happens all the time. Someone may have called in sick. So instead of having the 6 residents, you may now have 10.
Yeah.
So it changes. And by 8 to 9 o'clock, you're hoping you'll be able to get to your first break. But that may be pushed out to 9:30. So you're then swapping for first break for second break so you can get a break. But the doctor's rocked up. So there goes your second break. So you may not have got a second break, or if it is, it's 5 minutes. And in that 5 minutes, you may be trying to stuff something down your throat. So you forget about the toilet, forget about having something to drink, you just go, I just need some sugar. But then you've made 500 decisions by 9 o'clock. And people think, oh, they're big decisions. No, they're micro decisions. Like, oh, they're sitting over there, I wonder what they're doing. Oh, that person's moving too much, I hope they don't fall. While you're dishing out medications, thinking, I've got a blood transfusion going off in half an hour. This person's coming back from theatre, or I have to get ready for theatre. There's so many things happening for 6 people in a hospital. You are multitasking on a monumental level. Aged care sector, which I did last week, 2 of those doubles, I had 70 residents.
Wow.
So it's 70 rounds of pills of a morning and 70 rounds of pills at lunch, and probably about 50, depending on who had them. But, pill round took 2.5 hours. Insulins and Schedule 8 drugs, and I think, like, I can handle that. But a new nurse straight out of uni, they can't, and they stress and they falter. Agency nurses who may just be walking in for the first time, never have met any of them. It's your stress levels go through the roof. So the shift as a nurse, I think regardless of the sector you're in, you're making a ton of decisions autonomously all the time, and you're hoping that you're making the right ones for the best outcome for the patients or the residents or the people you're providing care to, but also for the organization you may be working in, and the multitude of either management or senior bosses that will come and pester you during that first 2 hours just to get the day to work well. And then the day's gone. And you're handing over and you're out the door, and you just go, oh, where did that go? And then you're like, well, what am I going to do for dinner? I've got to pick the kids up from school. I have to go to this after that. Then there's a washing. And then your second day starts after you've given your first half of your day to someone else's families.
Yeah, it's mind-blowing, really. And I guess this leads beautifully into the reality is that it's too much. The reality is, and looking at your website, the stats and all, that nurses aren't coping, and that's fair enough. Like, if they're trying to cope with that level, that intensity of work every day, I'm not surprised that, the stress levels of burnout and all. So stats-wise, do you have some stats for us, Mark? Because I saw some on your website. That's why I'm alluding to it.
Yeah, no, that's all right. So depending who you're looking for your stats from, the overall, like, 74.5% of nurses in primary care are stressed.
Yeah, that's huge.
3 out of 4, huge, are stressed or high levels of stress. You got 69% of nurses in Australia are absolutely exhausted. That's 7 out of 10. Like, you can see it. You can see it every single time you sit down in a handover room. They all sit down, they all do that. Because they're all completely gassed. The burnout rate varies depending on the study that's done, but overall it's around about 72% of nurses in primary care experience burnout. Now, there's no studies specific on aged care. I know they're looking at some, but that's so transient and so hard to pin down because of the nature of the industry. But the one that's a real shocker to me is since 2020, prior to COVID, 75,000 nurses have left the Australian profession since 2020.
Wow, that's huge.
We have just under 400,000 nurses in the country, period.
That's scary,
and
isn't it?
if that's what's, so we're looking at a deficit of around about 50,000 by 2030. We're short. We'll be short by 50,000 nurses by around about 2030. That's close to 42,000 shifts a day across the country that we're not going to have nurses for. The care minutes are in the millions every day. And you think, I hope my mum and dad or someone I know I love is getting those care minutes. What's there. So there's a real challenge around getting staff, keeping staff, retaining staff, looking after staff. And at the moment, everybody around the world is in that same problem, same challenge. So Australia is just maybe on differing degrees. The UK is in a real pickle at the moment. I know the US is going through a massive transformation. They're looking at close to maybe 800,000 nurses being short in the US by 2030. That's monumental, but the population size kind of explains why. So it's a real challenge, and most places I go to and do a shift in, there's always someone off sick. There's always a gap, at least minimum of one, if not two. The double I did last week, there were 3 staff off sick. Not sure, just they didn't want to come to work.
And if you're feeling going through winter in Victoria, and if you're feeling not 100%, you can understand why you don't have the energy for that intense work.
It is, yeah. And rostering and how you're rostered and what shift patterns you're doing, how many night shifts you're doing, like they all accumulate and take an impact, especially like hiring stress loads, hiring workloads. Their energy becomes a breaking point for
Yeah,
everyone. We're all human.
yeah, absolutely. Couple of things with burnout. We talk about burnout a lot. So from your perspective, what are we talking about? Like, what is burnout?
I think from my perspective, burnout isn't one single aspect, but it's a accumulation of you have a lack of physical drive and energy to be involved, or if you lack the physical motivation to deliver, or your body is physically tired, if you're lacking the physical energy. There's a component of sleep involved in this. You're not sleeping properly. You have such irregular sleep patterns, or you have runs of night duties. You're not getting proper adequate sleep, or you're not doing right sleep hygiene. You are emotionally or mentally not at your peak. And nutrition wise, which is the fuel for the whole body, is you may not be nutritionally supplying your body with everything it requires. So it's not one aspect. It's a holistic draining of everything you have in your body, your being, your energy, your character. It's just empty. And burnout doesn't happen today. It doesn't happen from one week. It happens from weeks and weeks and months and years of not having the ability to take the measures and the interventions to keep yourself the right side of sane in a way. And we all think we can just soldier on through it. No, we can't. You can't work doubles upon doubles upon doubles upon doubles, because you will either hurt someone or be hurt on your drive home. And the trade-off for money compared to hours is one nurses everywhere flaunt very, very well. I think I can do that double for that extra money. But what's the turnaround? So a burnout to me is when you actually have nothing left to give emotionally, physically, nutritionally, or even part of your sleep. Nothing is working for you. And so the job no longer becomes valuable. You're no longer passionate for it. You actually become detached emotionally from what you're trying to help people. And that's dangerous for you as an individual, from your own personal being, but also from the patient side, because we're caring individuals for these people. It's not just a task. It's not a rote task you can repeat like a factory line. Every person has their own situations, needs, and requirements. So it's a mixture of everything that keeps us who we are. And when we've got nothing left, that's burnout.
Yeah, and it's so sad because, as you were saying at the beginning, there's this connection between nurses, and you're passionate. You do this because you want to make a difference. You want to provide support and care. But
Yep.
then the burnout means that detachment, and that must be soul destroying for some nurses.
Very. You do. You see it, especially in some areas like the ones that have extremely high pressure, like ED and intensive cares and the critical care, where they're faced with the harshest of the harsh. It's a repetitive, constant feed of the things that do take impact to people again and again and again and again and again. Seeing that child again, seeing that car crash victim again, seeing them and just going, I'm just detached from caring.
Mm.
And it is a no fault whatsoever of the nurse, whatsoever. And this is something we don't do that well. We think it's our fault that we're burning out. We're actually not looking at it going, it's the system, it's the industry. Take yourself out of that situation. What is it that's in there that's causing the burnout, which me going in there becomes the result? Or is it me not looking after myself or not helping myself to understand where I can improve or what measures I can put in place to keep myself healthy?
Yeah. And do you think organisations or hospitals are not taking this seriously, or is there a point where it's not recognising? Like it's just really, and we'll talk about what you're doing business wise, because obviously there's a big gap there. So yeah, when you were in it, were you thinking, gosh, hospitals, employers could be doing so much more, or
I think now hospitals employers have realized how significant it is. And I will say they do try,
yeah,
but I think the options out there are so slim, if not to none, that all they can offer is what's available. And I think that's the gap. Plus, the other challenge is things that are offered actually detach or detract someone away from their work. It doesn't meet them at the coalface. It doesn't meet them at their job. It's actually making them leave what's important to them and go source elsewhere. Or it's reactive. It's at that end breaking point, which by that stage, the damage is done. And the damage wasn't that day. The damage was the month prior, or the 2 months before, or the 3 months before when they weren't sleeping properly. Today was just that the straw that broke the camel's back. So I think organizations are really trying, but the offerings are so limited and maybe not taken up the way they should be because they're not built for purpose. And that's where the gap is. I know many, many hospital execs around the world, and they all say the same thing. I wish we had something better. I wish we had something that was tailored to an individual, tailored to an individual group. The ones that's costing the most money, the ones where we're missing the biggest gaps, the ones that we can't keep. So that's a real resignation, because at no point you try and blame management.
no,
Because they're trying just as hard to figure out why, and they themselves are burning out trying to solve the same problem. So it's not organization. I think it's a systems issue that most places face. And you just got to take the people out of it and go, how can we improve the systems? Not so much how do we improve the people, because they're all trying so hard with the best intentions.
I love that. I think that's really important. I'm glad I asked that question because you're right. I think managers are there, and some have worked their way up anyway, and they're passionate about healthcare as well. So it is, everyone's got the right intention, but you're right. Sometimes the system and the funding and all of that and priorities of the
Exactly.
government that is making it difficult for everyone. So can you share with us all about your business, MACH Health? Because I think it's so important what you're doing, and it's a really unique take. And I think what's exciting about this is for managers, hospitals who are thinking, I don't know what to do. There's your solution. There's
Yeah.
plenty that they can do. So yeah, talk us through that, Mark.
Yeah. So probably a bit of preface to MACH Health is, after leaving direct clinical care, I spent a few years in different businesses where we looked at diseases such as Alzheimer's and the aging population. We built systematic, structured clinical pathways for use on scale of how we could break down the problem into a system, build interventions around the system, and then deliver them. We did this in China with people with Alzheimer's, around about 200,000 people, with amazing results. In 90 days, we could predict the predictability of non-pharmacological interventions for people with Alzheimer's living in their home, and we were able to slow that down. In the UK, we built an over 50s platform with a similar kind of system called the Structured Wellness Intervention Pathway, which is published about how we keep people healthy in the home. And we found people come off dialysis, reverse type 2 diabetes. We are systematic people. We love a plan, we execute it, we have our routines. As humans, we are exactly the same. Chaos and the random things provide the spice of life. But in everyday life, I like to go up a certain time, I like to have a coffee. And when those things don't go well, the day doesn't go well. So the way I looked at this was, a nurse as an individual suffers from four major things. They suffer from emotional health. They suffer massively from sleep health, sleep syndrome, sleep hygiene, devices at night. They suffer massively from physical health issues, injuries, longevity, burnout, fatigue, and they don't eat well. We just don't eat well. And it's Christmas is the greatest time and the worst time to be a nurse in the hospital, because you must get every box of favourites Woolies ever had. And that's what you live on.
Yeah.
So in 2023, I went away and looked at all the research, and I built a pathway called the Workplace Health Intervention Pathway for Nurses, which took all those domains and we broke down all the problems. And had that peer reviewed by 20 nurses around the world, and we're writing it for publication now. And that is the engine behind MACH Health. So MACH Health is a web app and also a mobile app in the Google and Apple Play stores. And it attacks burnout preventively. So we have over 400 pieces of content strategically and professionally made around those 4 areas, bite-sized 30 seconds up to a 10-minute meditation class or we will be running live classes in front of nurses in their workplaces, because I want someone coming to their job not going, oh, it's time for handover, to put their head up and go, hey, there's 15 minutes for all of us before we start work. And it's by a physio or a meditation expert or a positive psychologist going, you are worth the effort. The patients need you to be on top form so you can deliver the best care because you're brilliant at your job. Here's 10 minutes for you. And during the day, we send them notifications on, have you gone to the toilet? Have you had a drink of water? Are you on your break? Do you need 1 minute of stress relief? Here's a meditation. What time are you going home? Okay, great. What are you eating tonight for dinner? Tell us how you start your day. Check in with yourself. Show yourself how you're doing. And at the end of the night, how did your end of your day go? We offer monthly assessments as well. We have a news feed in there where they can collaborate as a community. And the goal here is to put the power in the nurse's hand by a nurse who's walked 95% of the different areas of nursing and gone, we really need help. Now people say, oh, it's another app. It's a mechanism for us to go in front of people and say, hey, you really, really matter.
Yeah.
And here's some simple ways that we can maybe just start building in those daily habits that get you one step closer to center. Maybe get you that one night better sleep or that one healthier meal choice. Or maybe we can get you stretching your neck so neck isn't sore every time you bend down giving out medications. Because it all starts as with one. You don't have to change everything on day one, but by building the habits in, I hope we can change the narrative around reactive well-being and health for nurses. We're in front of it. And over time, we'd like to say we can look at this group of nurses and how they're doing and then apply that to a different sector, say aged care, where they're really going to need it. So currently at the moment, we're in discussions with a few hospitals around Australia. We were having a pilot with the NHS later in the year for a full hospital and the university attached. As you can see from LinkedIn, we're getting tons of exposure around the world. As I'm wanting to drive home the message, like this is all a systems issue. It's not a people issue. And let's re-engineer it to say, let's put everybody on the front foot. Let's give them something that's tailored 100% to them. So everything in MACH Health is tailored to the nurse. There's no random stuff. It's not, oh, I was going to do something randomly for a tradie. It's like, no. They don't understand the nurse, and everything changes depending on the shifts you do. So if you do a morning shift, the system changes and talks to you in a different way. If you're on a night shift, we talk to you completely differently. We have stuff going out to you at 2 a.m. or 3 a.m. in the morning to keep you awake, asking you to put down that soft drink and pick up a chamomile tea. We're trying to make small changes. And then when you get home, hey, what are you doing for bed? What time are you going to bed? Can we just make those little steps forward? So at the moment, we've just had like resounding interest in what we're trying to do. As we met at the Digital Health Festival, we found that we were the oddballs out greatly. I work with a wonderful team in Sydney called Cognos who've helped me take my concept into real idea, past MVP to pilot stage. So it's exciting, but it's available for free on the Google and Play now. So every nurse is listening to reason, jump on, give yourself the chance. I do it every day. My wife does it. My mates do it. The other nurses I know do it. And they're like, I've got to check in with myself today. Because you know what, Tisha? When I was a nurse, none of this was around. No one cared. It was just like grind through it. And we'll go to the pub after. Yeah, that was a solution. But really, at the end of the day, no one really said to each other, how you doing? Just generally, how are you doing? Because one, we may not have thought it was okay to ask, or two, we were probably afraid of the answer we might got in return because it was just a mirror image of how we were doing at the same time.
Yeah.
And it's giving people that place to go, okay, this is all about us and me. And I feel safe here.
Yeah, and look, that is so important. And I think, it's amazing that it's been built by nurses. So there's that connection. that, yes, you get it. So it's not just this, do this meditation, then you'll be fine. There's
No.
that. And I didn't realize to even be able to adjust it depending on what shift, because of course that's very different. A nurse getting up at 5 o'clock and being there at the beginning compared to one
Someone gets to sleep
starting
in.
at 10 p.m.
Yeah. It's a whole different mental lead into a shift. It's a whole different challenge you face depending on the shifts. And what happens after the shift is just as important what happens during or before it. And sometimes that's just as more damaging.
Yeah. No, this is amazing, Mark. So I think a couple of things in terms of if people want to, we'll have everything in the show notes, and I'll share on socials and all as well. But the actual app is
Yep.
called
MACH
MACH
Health.
Health, and that's spelled
MACH.
MACH Health. And I've already downloaded, not that I'm a nurse, but I had to lie a little bit when I
That's
put
okay.
the stuff down, but just to see and check it out, and it's amazing. So yeah, regardless of what type of phone you've got, there's
Doesn't matter.
apps there, which is really good. And in terms of if someone's listening who's in an organisation working at a hospital, can they contact you as well?
Just email me. Email's mark@machhealth.com.au. Drop me a line, pick up the phone, give me a call. I don't mind. Even if you just want to chat about the challenges you're facing, or would you like a free pilot or a trial, I'm happy, because we're going to be in a real problem, and I'd rather people have a possible solution they can take home. They can take it to their work and they can go, hey, someone's reminding I need to go to the toilet. I haven't. It's like 6 hours and my kidneys are killing me. That's every 2/3 of female nurses say that. And it's like, why should you have to be reminded to go to the bathroom? It's the simple things, but no one really thought to ask them that question. And we can set something up really quickly, no cost, and we can see what impact we can have for people. It's just about helping now and getting the name and getting in the hands of people, and then listening to them saying, we'd like to see A, we'd like to see this, we'd like to see that. Because we like to build quickly and adapt and change and make sure that we can make it as personal for them as possible.
Yeah, no, that's great. And it's no different to living with a health condition. For me, living with MS and now cancer, it's like you have to be proactive about your well-being. And nurses are human, like all of us, and they have to be proactive about their well-being. And then organisations, the stats you're giving for 2030, that's dire. So organisations need to be proactive about organisational health. So I think what you're doing is really important. And as we'll quickly mention, I'm very excited because part of the Hurdle to Hope worker wellbeing workshops are going to be part of the app as well, which I'm really
They are
excited
indeed.
about, because what I've done in this space is in relation to I've lived as a patient and I've witnessed from a bed as to what nurses go through. So you're privy to that, especially when you're in hospital for months. And these workshops are very much about not just patient interactions, but how to use the Hurdle to Hope roadmap in relation to workplace challenges. And I think so many times people with lived experience have great insight as to how proactively to manage burnout or prevent burnout. So yeah, I'm very excited that we're on the same page and to be part of the MACH Health app as well.
Yeah, no, we're excited to have you on board, Tisha. And I think one of the things we're trying to do within the app is create an environment where we have experts like yourself, we have people with lived experience, health professionals with lived experience, who provide a range of different services, personalized things that nurses may not understood were even available, and say, hey guys, I can't do everything, but I work with a group of amazing people who do the rest. And maybe you need to seek help from people. And that's the point, is to bring the world to the nurse, not the nurse have to go and search the world. And if we can do that person by person, then week by week, I think we've got a real shot of, making a real difference, not just in Australia, but around the rest of the world.
Yeah, no, really exciting. I'm so glad our paths crossed in
So
that
was
big
I.
convention centre. But you're right, we were both, there weren't very many people with lived experience and, lots of people with amazing ability with all this tech stuff. But you want to make sure AI doesn't replace real voices and real experiences.
Exactly.
So I love what you're doing. So please, as I mentioned, we'll put all the details in the show notes. Also go to machhealth.com.au
Yep.
or go to any app store and go to the MACH Health app, and do get on board, because this will help if you're working frontline and if you're an organisation who is like, what can we do? You can turn to Mark and have a chat to him as to what you can do to really protect your greatest assets in terms of who's providing service for us all.
Yeah, no, thank you. It's been great to be here. Okay, I suppose to leave you with one thought is that there's nothing wrong with trying. That's where people stumble. We're all a bit afraid to say, oh, that's not me. But then when we do something, that kind of penny drops and we go, actually, that was a bit of me. I really needed that. I never thought I did, but actually I really needed that. Most people are really afraid to try because that opens up maybe a wound or a scar that they didn't want opened up. And my goals, we have this in the hand of every single nurse around the world in 5 years.
Yeah.
And it's a big challenge, but I think the world is ready. And I think nurses are one of the most amazing peoples on the planet. And we have a voice that when it's together is extremely powerful. I hope that this can be the start of that voice now getting the power it deserves to say, hey, we need to be looked after. We're going to start with this. MACH Health is just the start. It's not the end. And as time goes on, we'll bring more amazing things to the nurses and really help them on everything from financial help. It'll be family planning. The world's the oyster in this one, because it's not just the work they spend their time at. They come to work to live, not live to work. But at the moment, they're living to work. Yeah. So our goal is to change that narrative and help them one at a time. So don't be afraid to jump on and try. Reach out to me on LinkedIn or Facebook. You can follow us as well. And join the revolution, because we think it's going to be that. And we hope we start that here in Australia.
Excellent. Thanks so much, Mark. I really appreciate it.
No, thank you, Tisha. Cheers.
Yes. Okay, so I really hope you enjoyed that chat with Mark. I learnt a lot, and it's scary. The stats he shared are really scary, because the reality is we need healthcare support. Nurses are leaving, and we need to do all we can to help support the nursing profession. Again, it's the same in aged care, it's the same in NDIS or disability sectors. That frontline staff are really struggling, and we need to provide support for them. Part of what I'm doing here at Hurdle to Hope, if you are frontline, please visit Hurdle2Hope. Remember, Hurdle2Hope with the number 2.com/PD. They're different workshops that I'm running. You can, if you're a nurse, go through the MACH Health app, like we mentioned when I was chatting to Mark. You can also go to my website and have a look for different sectors. If you're an organisation, I would love, especially after my experience this last week, to run some more of these workshops, schedule a call, and we can work out how to best support your staff. Other than that, I am going to have a really chilled out week, doing a bit of work, but really enjoying myself here at Daisy Hill. As I said, I absolutely love it here, and I really am excited to keep bringing you different intros and reels and all from our property here, sitting on the different rocks that Andrew will be putting throughout the property. I hope you also have a great week. Please listen to the previous couple of episodes if you haven't already, and let's spread this Hurdle to Hope message, whether you're frontline staff, but also if you're living through any unexpected hurdle. The insights shared will help you in moving forward, and I look forward to chatting to you again next week. Have a good week. Thank you for joining me on the Hurdle to Hope show. Please help me spread the word. Share this episode or others to friends, family members who you think will benefit from these conversations. Don't forget, we're also on YouTube now, at Hurdle2Hope is the channel. And if you need support, resources, or a speaker for an event, please visit Hurdle2Hope.com. Don't forget, Hurdle to Hope with the number 2. Enjoy your week, and if you're going through a difficult time, please remember, even in the darkest moments, hope is always there.